through who's a candidate, recovery time, and basically what the process is to get this type of breast reconstruction. So first of all, I want to say that breast reconstruction is the law. Unfortunately, I've been seeing patients here that still don't know what their options are. They still don't know that reconstruction is a choice for them. In some states, there is a law that any woman who is diagnosed with breast cancer, whether she's going to be having a lumpectomy or a mastectomy, it's required by law in these states that the patient needs to go see a plastic surgeon before anything is done. Unfortunately, here in Texas, we don't have that law yet, and I get patients here on in my clinic on a weekly basis that, didn't know what their options are. Now they've undergone a mastectomy or had bilateral mastectomies, and now they want reconstruction. And when I go over their history with them, many of these women had the option of undergoing immediate reconstruction, which always gives you a better result. You have the mastectomies and the reconstruction in the same operation, so there's one recovery time. And for women to go to sleep with breasts and to wake up with breasts is a very important thing, psychologically, emotionally, and physically. So today, I want to share a little bit with you of what happens when a breast cancer patient comes to see me to see what their reconstructive options are. So the most common type of reconstruction that's done today is implant-based reconstruction. And basically, expanders, which you can think of them as water balloons, can be put in at the time of mastectomies or after. So that would be called a delayed reconstruction, when the patient has had their mastectomies and months later they come in for their reconstruction. So expanders can be placed, and then after the expander is blown up with salt water to stretch out the skin, implants can be placed. And so that's the most common type of breast reconstruction, but it's not for everyone. Patients that have had radiation or are going to undergo radiation, they have about a 1 in 3 chance of that failing. And so I see many women that have had that type of reconstruction and they're not happy with it and they are seeking something else. So that's implant-based reconstruction. So when you're using your own tissues, the most common place to take it is from the abdomen. So, skin and fat can be taken from the abdomen to rebuild the breast. And, some patients will hear that, that word tram flap, which is an easier procedure to do, but it takes muscle. And when a plastic surgeon tells you that you're a candidate for a tram flap, then you're a candidate for a DIEP flap by default. So, you don't have to take muscle when this procedure is available now. So the patient will come in and see me, I examine them, and most women who have had children, they're going to have that extra tissue to be able to rebuild their breast. I've had some patients gain weight to get enough tissue to rebuild their breast, and these are my very thin patients who don't want to have implants or who have already failed implant-based reconstruction. So they've gained weight and we're able to have the procedure. The incision is basically a tummy tuck incision. So when this procedure was invented, the doctor realized that during a tummy tuck, there are these vessels that go into the skin and fat, and that these vessels could be traced down to blood vessels that can subsequently be connected up here in the chest wall. So basically, a DIEP flap is, in essence, a transplant. So you're transplanting skin and fat to recreate the breast. So the recovery time is basically from the tummy tuck portion of the procedure. Most patients will complain about discomfort and pain there. The majority of patients will take about 2 to 3 weeks off of work to recover. And you have to remember that these procedures, whether you choose implant-based reconstruction or using your own tissue, is that it's a two-stage procedure. So you're going to have the first one, whether it be mastectomies and implants or expanders, and then if you're using your own tissue, 3 months after that initial procedure, you go back in for a quicker procedure. That it's a in and out procedure. You go in, it takes about 2 hours to make the breast more symmetrical or recreate the nipples for the patient, and then you go home the same day. And then the final part of the procedure is going to be the tattooing, and that's done by the tattoo artist, usually in the office. Okay, you'll be in compression garments, basically for the swelling, just like as you would during a tummy tuck. And you wear a compression bra. I usually have my patients wear a compression bra for 4 weeks. And so the benefit of using your own tissue is that it can be a permanent solution. You don't have to have implants, and patients who have already failed implant-based reconstruction or don't like the feel of them or just don't want anything foreign in their bodies, they're a candidate for this procedure. It's best to go in and have a one-on-one discussion with your plastic surgeon, but you have to make sure that you know what all your options are before you make your decision of what you want to do. I preach that all the time to all my patients because I've seen those patients that could have had their immediate reconstruction, but instead, they were told that, a plastic surgeon's not going to do their procedure or doesn't take their insurance. There's just misinformation out there, and it's unfortunate in this day and age with all the available resources we have on the internet and social media that I see women, and I hear their stories, and it's just unnecessary. So the goal is, when you get a breast cancer diagnosis, it's very devastating, and then it's a whirlwind. You feel like you're, in this never-ending rabbit hole, and you're seeing doctor after doctor, and the reconstructive part usually gets pushed to the side. But it's very important that at the beginning of your journey, you know what your options are, so that when you reach that point for reconstruction, you've already done your research and you've decided what you want to do. So if you want more information or you want to see me in my practice, you can give us a call at 915-351-9000. Thank you.